Hi, this is our rapid update on therapeutic news. In the next few minutes, I'll be covering news from the BNF, MHRA, NICE, and also talking about the MA and Antimicrobial Resistance National Action Plan. But I'd like to start with some good news about iron. As we know, iron is well recognised for its side effects, so constipation, diarrhoea, abdominal discomfort, or nausea. I wonder how many people have a pile of medicines like this at home. And it's not often we get an opportunity to make an easy reduction in medicines, which is better for the patient, better for the environment, and also better for the NHS. So you may already have heard about this, but the BNF has reduced the daily dose to one daily, and if that's not well tolerated, to alternate days. And this is for most of the iron salts. So useful to remember when we're either starting iron or we're reviewing. Quick reminder, the BNF states that the blood count should be monitored in the first 4 weeks to check the response, and you'd expect to see a 20 gram per litre increase in the haemoglobin after 4 weeks. And then a reminder there to continue for 3 months after the haemoglobin is normal. Moving on to montelukast, which is used in asthma. This drug safety update aims to increase awareness of the infrequent but important risk of neuropsychiatric reactions, so advising patients to look out for changes in mood, sleep, or behaviour, and to seek advice if these things occur. It's probably also a reminder for us to check that we're using montelukast in the right step in the asthma pathway. Moving on now to finasteride, used in male pattern hair loss and benign prostatic hypertrophy. So it's a reminder here of the risk of psychiatric and sexual side effects. Finasteride has been associated with depression, suicidal thoughts, and sexual dysfunction. So before prescribing, we're asked to check with patients whether they've got a history of depression or suicidal thoughts, and to monitor patients for these problems as well. Moving on now to NICE updates, and they produced a guideline on identifying and managing familial and genetic risk in ovarian cancer. And this guideline encourages referral for genetic testing for at-risk groups, including people with first-degree relatives of ovarian cancer, or a maternal or paternal secondary degree relative with a diagnosis of ovarian cancer. And there's a good, nice 15-minute podcast on the topic if you'd like to have a more full update on that one. The next guideline I wanted to highlight from NICE is the sepsis update. It's a partial update. The update's still ongoing otherwise, but in this they recommend a change in the time to treatment for antibiotics and suspected sepsis, so that people with moderate risk of severe illness from sepsis, the clinicians can consider deferring the administration of the broad spectrum antibiotics for up to 3 hours. And this time then can be used to gather more information and make a more specific diagnosis. And for people with a lower risk, that deferment can be up to 6 hours. So hopefully this will enable the use of some more targeted antibiotics and therefore reduce the adverse effects and antimicrobial resistance risks associated with broader spectrum antibiotics. So that brings me on to the next slide, which is the National Action Plan to tackle antimicrobial resistance, and that was been just published in May. As we know, antibiotics, they underpin modern medicine. We need to look after them, and this plan outlines the outcomes and commitments which help us to look after these antibiotics. Under the previous plan, we've seen reduction in antibiotic use, including significant reductions in food-producing animals, and we've also seen innovative ways of evaluating and paying for new antibiotics. So the new 5-year plan sets out 9 strategic outcomes for the sectors across human, animal, environment, and food. It's underpinned by a number of commitments, which include raising public awareness, animal health and welfare initiatives, and supporting professionals. There's also commitments which recognise the environmental issues and waste management needs. So we'll put a link to the National Action Plan in the post-webinar document, and that'll also contain a brief summary and links to the other items I've mentioned. Thanks.